We're back at 12 minutes after the hour. President Obama and congressional leaders have cited the Mayo Clinic as an example of quality health care at a reasonable cost. But can the Mayo Clinic and other medical group practices maintain that quality of care under the health care plans being considered in Washington? Joining us right now with his prescription for health care reform is Dr. Denis Cortese. He's the president and CEO of the Mayo Clinic. Also joining us now is Bloomberg News' Michael Waldholtz. He's the managing editor of health coverage here at Bloomberg News. Mike, good to have you with us. Dr. Cortese, good to have you with us. Let's talk about this coverage that's being considered in Washington. I mean, can they maintain the care that we've all known to kind of expect at this point under the plans being considered in Washington?
Well, that's an interesting question. There's so many different plans, it's hard to know for sure. But I think if they continue to move in the direction of trying to pay for the outcomes and the safety and the service that we all want, the access to patients, that yes, we should over time be able to improve the value of health care to all of our citizens in the United States.
Dr. Cortese, you've said that there are aspects of health reform that really would be important for the Mayo Clinic especially, but also for America, really talking for value. There are some aspects of the bills that are really interesting in that way. Can you describe what aspect of that would be most important and whether, in fact, any of that are in the bills that are now being proposed in the House and the Senate?
Yeah, I think the major aspect, at least for now, in the immediate future, should be to come to grips with the fact that paying for value, identify what we mean by value, identify the metrics that will be used to measure it, also to create the transparency, and then to make a very clear statement that in the near future, 1 year, 3 years from now, that the country, particularly Medicare, that's the largest insurance company in the country, will start paying for value. If we can get that built into the process right now, I believe it will pay off dividends in the near future. When I say near future, I mean the next 5 to 7 years.
Again, do you see anything in the bills right now that would do that?
Well, there certainly are. Again, it depends which bill you mean. There are several bills or proposals that are in the House. There's the tri-committee proposal, for instance, and then the Senate has the HELP bill, and then the Senate Finance Committee does not have their bill out yet. So my comments are in the construct that we really won't know exactly what the bills contain until maybe a month from now. However, the discussions that are being held that talk about, well, maybe we should create an independent body to help identify value and pay for it. Well, that's clearly a step in the right direction. I'd like to also propose that the politicians consider putting it in the charge of the job of the Secretary for Health and Human Services to say in maybe 3 years, Medicare will be paying for value, and you could begin the process by defining the value parameters around the top 3 to 5 conditions that affect the American public, especially when we get older, the top 3 to 5 procedures, and a few areas of safety. For instance, we should identify that there should be no in-line infections. In other words, infections that occur in patients that have lines put in their body, and no infections that occur in the hospital. There are certain things that can be done to start us on this course. Well, so I have heard discussion about that, but I haven't seen it yet in writing in a final bill.
Well, one of the biggest contentions out there is whether there should be a public plan, an insurance plan to compete against the private insurers, or whether it should be something like a co-op, or neither one of those. Would any of those contain what you're talking about, some kind of teeth to sort of, I mean, that's one of the issues that the Obama administration has been talking about, is trying to lower costs, or at least lower the increase in cost by improving quality of care or the outcomes. I think that's what you're talking about.
That's exactly what I'm talking about. Fundamentally, I do believe that the only way to bend that growth curve, to slow that growth curve downward, is to make sure that all the services that are being provided are the safest that they can be, with the best outcomes we can get, with very good service for patients and the lower cost over time. That's the value equation. So when we look at the issue of the public plan or the non-public plan or insurance for everybody, we're a strong supporter for insurance for everybody. But insurance for everybody alone does not solve the problem. You need to have a commitment to make sure we're paying for value also. Now, with regard to insurance for everybody, this issue around the public plan, it's hard to make a judgment yet because there is no single statement of what is meant by a public plan. If we mean a public plan that is like Medicare, fee-for-service, with price controls, with no attention to outcomes or safety or service in the way it is paid, that would be a catastrophe for the country, in my opinion. On the other hand, if by a public plan we mean the federal employees model, where people, something like the federal employees, where people can have choice, they can select which option they would like to have and maybe buy upward if they'd like, the government helping to support the premiums that would be built in there. But in either case, if you don't build in value, you really won't be able to bend that curve and get the return in the next 4, 5 to 7 years or so.
Dr. Cortese, let me ask you, though, some see this health care plan or what's being talked about kind of a work in progress, so that maybe we don't get everything right out of the gate. Is that problematic, or can we get something out and then we kind of continue to improve upon it as we go? Can we do that?
I think the latter is yes, we could do that, especially if we made a statement now that in the next 3 years, Medicare will be paying for value. That's an insurance company that's already up and running. It's the largest public plan in the United States. It's the most expensive in the United States. And frankly, we all know that it's going to bankrupt the country. So somewhere along the line, we need to come to grips with paying for value. And we're recommending that let's do that in Medicare. Let's get that started now. Congress is the board of director for Medicare. They should be able to get that started very soon. In the meanwhile, let's get as many people covered as we can, and if we have to, do it incrementally. I prefer to try to do it as quickly as possible, but you could do both, but you have to have the commitment to getting more people insured and this is a big and, begin to pay for value.
Well, Dr. Cortese, quickly, I think, is we have just a little less than a minute. But, the Mayo Clinic has been cited, along with the Cleveland Clinic and some other places, as a potential model for American health in the overhaul. Is that an honest comparison? Are there things that you folks are doing that the rest of the country should be doing or could be doing under health reform?
Well, I think it's an interesting comparison. There are a number of institutions that are modeled the way Mayo Clinic practices, but I just leave you with two messages. Number one, the core issue of Mayo Clinic is the needs of the patient come first. And the second component is teamwork, building people around the needs of the patient, creating what needs to be done for the patient, but that is the focus.
All right. We're going to have to leave it on that note. Dr. Cortese, thank you so much for your time, and our own Mike Waldholz. Thank you as well.